In the CKD, the patient who are on maintenance hemodialysis, a simple question comes: how to check the clearance? If I have to put it more simply, how to check whether this particular patient is getting adequate dialysis or not. Dialysis basically doing the clearance function of the kidney. That is, it is removing the waste products, similar to the functions of the kidney. Whether it is adequate or not, how to check it? Is it only through urea creatinine? But after every dialysis it goes down. Then how to check it? Simply, there are many ways to check it. Even before, for example, a patient who is getting inadequate clearance or inadequate dialysis, over a period of months will go to malnutrition and poor quality of life, thereby comorbidities. Even before the comorbidities occur, there are simple steps to find out. Before going to that, this is only for CKD patient, chronic kidney disease, end-stage renal disease who are on maintenance hemodialysis. Not for AKI patient, not for AKI and CKD. Only for CKD, MHD patient we are discussing. How we are going to check whether the patient is receiving adequate or not. The first one, the patient's requirement for erythropoietin to maintain adequate hemoglobin, that is more than 11 or 12 gram. To maintain adequate hemoglobin, the patient requires very minimal amount of erythropoietin. No need for you to every time adjust, escalate the dose. Sir, I am not escalating the dose, then how I will find out? The patient hemoglobin might be on the lower range, not on the normal side. Normal for a CKD patient might be towards 11. The patient might not be having the normal one. If you check the report, it will be 7, 6. That means obviously you are going to escalate the dose. You are going to find the cause. That is one subtle parameter. Patient hemoglobin is not achieved. The first one. The second one, the requirement or need for the BP medication remains stable or at lower dose. Maximum 1 to 2 drugs you are giving at adequate dose. BP control, well and good. If patient is requiring 3 drug, 4 drug, 5 drug at maximum dose, BP not under control, that is a subtle sign his clearance might not be adequate. This is the second one. Coming to the third blood parameter, serum albumin. Serum albumin ideally should be above 4. Serum albumin ideally should be above 4. That itself indicates patient nutrition is good. How the nutrition can be good? Patient might be taking adequate food. Why? Because he is not having that uremic feature. That is why he is doing approximately or apparently doing fine related to the nutrition status. This is a relative factor. In a patient who is losing protein in the urine might be having less, but on an average you can take serum albumin above 4 milligram in the blood report. Next one, total cholesterol level above 200. In the body, the cholesterol also indicates one of the parameter of nutrition. It is above 100 milligram. Next, serum creatinine. Here it is bit paradox. Pre-dialysis level above 12 milligram. Here some student might get confused. Sir, what is this one? To reduce creatinine only we are giving dialysis, and you are saying to see the clearance creatinine should be high. Creatinine indicates a nutritional status, patient's catabolism and the metabolism status of the patient. In a CKD maintenance hemodialysis patient, a pre-dialysis value 12. And nadir I am saying. A patient not taking dialysis goes high only. It is not like that. Nadir, every twice weekly he is coming. Before the second dialysis or before the twice weekly, let us take he is getting dialysis on Monday and Friday. We are getting the report on Friday before the dialysis. If it is above 12, it is a good sign. Another point, if the blood urea is less than 180 range, 180 milligram per deciliter, 180 and below, creatinine above is a good sign, urea below is a good sign. It is one bit student might get confused. So what we have seen, low requirement of erythropoietin, BP well controlled, patient total cholesterol above 200, serum albumin, urea below 180, creatinine on an average about 12, pre-dialysis on a patient who is on maintenance hemodialysis, not because he have missed the dialysis. Good appetite and the patient getting adequate 4-hourly dialysis twice or thrice a week. This is related to only the clearance. Don't mix other aspects of dialysis into this duration why you are telling and all. 4-hourly regular twice weekly dialysis for an end-stage renal disease patient with adequate blood flow at or above 300 ml per minute and a dialysis flow 500 ml per minute. Twice weekly 300 ml per minute with a good functioning vascular access. If these are there, that means a patient might be apparently doing fine with the clearance. And one more simple parameter is adequate calcium phosphorus control along with the normal parathyroid hormone level. Normal 2 to 9 times the normal. So these are all the 6 to 7 simple steps to know the adequate clearance in a patient of maintenance hemodialysis. These are simple steps a medicine resident can follow, can check it. Then there are always, if these are the simple steps, then what are the complicated things? Yes, there are there, which is called KT by V, protein catabolism rate, PCR, KT by V, PCR and urea reduction ratio. These are the formula related stuff by which we can assess, but these might not be recovered at the MD level. MD level you can go through it. For the patient care also, this whatever we have discussed is enough. This it's the next level, or for a nephrology resident or in charge in the dialysis who might be requiring what is KT by V and all. Those and all technical aspect we will discuss afterwards. This simple one along with the patient's quality of life. Quality of life include sleep, how he spent non-dialysis days, whether his appetite is good. These are things you can take. So there are simple parameters from the history and from the patient basic blood markers, and subtle clue you will get this patient is getting inadequate clearance. This is what the topic for today is. So if the patient is inadequately cleared, you have to plan accordingly. Most important is the compliance. 3 to 6 months of inadequate clearance leading to complication after 6 months, 9 months, malnutrition, comorbidity will set in. Then it will be a bit difficult to treat it. We have to intervene when the clues is evident. Okay, this is what about related to how to check adequacy of clearance, simple terms. Bye bye, we'll see you in next video.